So let's just have a quick look at from the Addiction Counselor's Competencies, the TAP 21 book. Let's just have a look at Competency 91. We're going to have Comp 91 and 92. And I've included a digital copy of the entire TAP 21 linked on the lesson page for this lesson. Okay, so let's just look at Comp 91. So facilitate group growth within established ground rules and movement towards group and individual goals by using methods consistent with the group types. So we're looking at group and individual goals. So there's another lesson on group goals, so you know what they are and can identify them when they happen, and you want to be able to document that too, and that the individual is progressing towards their individual goals as identified in their treatment plan. Okay, so this is the knowledge that you need, and you can look through this, but here's where you are: facilitator, and then the skills. From a skills perspective, these are the skills that we're going to address in this training, leading to measurable progress towards group and individual goals and outcomes. So measurable, that's measurable, observable, attainable. You can document it when it happens, when you see it happen before your eyes in group because you're observing. You're going to document measurable progress towards group and individual goals. So there are group goals and there's individual goals as identified in the patient's treatment plan. And then here, attitudes. Just have a look at that. Okay, so this is some of the material we're going to be covering in the actual presentations. Okay. Okay. In conclusion, let's just have a closer look at Competency 92. As part of the PowerPoint presentation, understand the concepts of process and content and shift the focus of the group when such a shift will help the group move towards its goals, or to shift the focus if they drift off, to bring it back to either what the group topic is for that day or what's being discussed, or in an individual session, what's being discussed on the patient's treatment plan. And then it's broken down into knowledge, skills, and attitudes. So let's just have a look at the knowledge here. You have the concepts of content and process. So there's the difference between the group or individual process and the content of the discussion. So what the patient is saying may be different from what the patient or group is actually feeling as part of the process that they're going through. The methods and techniques of group or individual problem solving, decision making, and addressing group conflict. How process variables affect the group's ability to focus on content concerns, and how content variables affect the group's ability to focus on process concerns. So let's just have a look at this word process. If we go back to when we were discussing the definition of recovery is a process of change, it goes on from there. If you wanted to look up what process means, and it's a clinical word that we use a lot, okay? Process is defined as a series of steps or actions to achieve a particular goal or outcome. Okay, now that sounds like a treatment plan, or with a series of steps, 12-step programs. But as far as treatment plans go, a treatment plan is a series of objectives or steps that an individual will take to achieve a particular goal, which is, recovery, yes, but there's other issues there, family, legal issues, social issues, and as well as substance use disorder. Now, the skills that we need for that is observing and documenting content and process. So when it comes to documentation, you definitely want to document or write down what the patient says. And you can even put that in quotes. Patient reports, quote, "I'm feeling much better now that I have 16 days clean." That's what they say, and that they're feeling better than they did when they had 1 day clean. And we could support that through urine toxicology screenings. So we have documentation that the patient is 16 days clean. And how does it feel having 16 days clean? Feels good. That's how you would document all that, and that's good documentation. Assessing when to make appropriate process interventions. So we want to make sure, again, that you ask yourself the question, is what we're discussing in the individual counseling session or the group session, is you want to, from the perception of the client, does the client perceive that what we're discussing and talking about will help them to be successful in their treatment goal outcomes? We don't want to be in, counseling is not a chat session. So using strategies congruent with enhancing both process and content to make individual and group goals. So what we're discussing in group and in individual is the achievement of their treatment plan goals or the treatment plan objectives to achieve a goal. As we explained about SMART goals that are observable, measurable, definable. So the attitude, our attitude, appreciation of the appropriate use of content and process interventions. So, again, does the client perceive that what you're working and discussing with them is going to help them be successful in their treatment plan goals and objectives, or their life skills, life goals and objectives? Otherwise, we're just, we're not a group, is not a coffee clutch, these aren't chat sessions. We're professional counselors, and we're working in collaboration with the patient to achieve their treatment plan goals.